I'm Dr Sarika Shah and I am a dentist. I'm a clinically working dentist. I'm also the principal of a multi-award winning clinic, which I'm really proud to say, Platinum Dental Care in Canary Wharf in London. And more recently, I'm also the founder of Flourish as a Female, which is the first and, from what I understand, the only platform which has been set up to train and coach women in dentistry on self-leadership. Our talk at the Dentistry show in Birmingham is called Inside Out Leadership. And what it's essentially going to do is bring together emotional leadership in practice and emotional-led marketing. What we're going to be talking about is how important emotional leadership is in practice, how we need to lead ourselves first as clinicians, how that then falls into leading our teams, how that then falls into leading our practices, and then how we can bring together emotional-led marketing to really build success and growth in our businesses, but as individuals as well. Emotionally led dentistry is so important because essentially as dental clinicians and as business practice owners, we really have to bring the clinical aspects of dentistry with leading a practice and leading our teams, and also then taking into consideration how our patients feel about the entire journey and the experience as well. So it's bringing it all together. And I think when it comes to emotion-led dentistry, it's about really looking at how we can create a team culture that's going to really influence our patient experience. So I think when it comes to patient trust and communication, I think the most important thing really is to create that relationship on a very human level with our patients. And I think when it comes to dentistry and as clinicians, what we tend to do is go back to that kind of black and white explanation of our treatments and relationship building with our patients. And what's really important is that we understand why our patients have come to us, really try to understand what it is that they're looking for, and start to build a relationship on a very in-depth and human level with our patients as well. It gives us a really nice platform to be able to build trust. One of the most important things that patients are looking for, that our team members are looking for, is psychological safety, okay? And when we're able to then connect with our team members and our patients on that level, what starts to happen is we build trust. And trust is the foundation of building rich and meaningful relationships. It's from this platform that we can really then start to understand what it is they're looking for, what they want, and then be able to make decisions in a way that is really aligned with their values, really aligned with their long-term goals for their oral health, and taking all that into consideration to then build a really seamless, smooth journey at our practice for them. Self-leadership is having the skills to be able to have self-awareness and be able to regulate and control your thoughts, your emotions, and your actions. So many dental clinicians and dental practice principals and owners will jump into leading other people. But I'm such a strong believer that if you can't lead yourself first, you can't go ahead and then lead other people. And I think that if you think of dentistry as a profession, it's such a high-pressured profession, high-pressured environment that we're in all the time. And we need to have self-leadership skills, especially when there are situations that are unpredictable. We have to have the skills to be able to regulate that first. We also have to have the emotional intelligence, which is a huge part of self-leadership, to be able to recognize what the other person, which might be a patient or a team member or someone that you've affiliated with outside of the practice, where they stand emotionally as well. And then with clarity, be able to make the right decisions in a very informed way. So many dental professionals, because of how high pressure dentistry is, suffer with chronic stress and overwhelm and don't know how to regulate it. The way it shows up clinically is that we have a lack of focus, that we find it really difficult to make decisions. We become really ineffective communicators when we're under a lot of stress. Stress is a high-level emotion. And when we don't recognize it and we're not able to regulate it, it just means that also in terms of our performance, we're underperforming to some level as well. It can really affect how we show up as clinically as dentists, but also how we show up as leaders, how we show up in terms of managing our surgeries, in managing our teams, and managing our business. When we're not performing optimally, inevitably it's going to affect our revenue, it's going to affect our growth, and it will slow down in how we want to achieve some of our goals as well. I think that for so long there has been lots and lots of talks around clinical dentistry, which is of course really important, but also some of the macro elements of dentistry and leadership. What is going to be great about our talk is that Anna and I are coming together from two different sides of dentistry. I'll be coming from the clinical side, the practice management and leadership side, and Anna's going to be talking about emotional-led marketing and branding. We've learned so much in our journey academically over many, many years, but both of us are actually living it. We're living through that real life experience. We're actually not just talking the talk, we're walking the walk, portraying that golden thread all the way through from the beginning of how we look at our own self-leadership to then bringing that outer leadership into how we lead other people, how we lead our teams, how we lead our patients, and then taking that out and really looking at consumer-led marketing. We're then connecting everything together, and it's that micro-level connection with the knowledge of all that macro-level clinical knowledge and also the macro-level leadership knowledge as well, that is then now going to elevate new age dentists to just a completely different level. It's going to really bring the USP to how they are then showing up as clinicians and as dental practice leaders. There's a story behind how I set up Flourish as a female. I've been in the industry for almost 20 years now, and in that time, I've experienced so much. I've experienced working in the NHS, I did my master's in restorative dentistry, and then I transitioned into mixed practice and private practice, and then I bought my own practice. So I've been through that whole transition, and in that time, there's so much that I experienced as a female. And I think there were so many aspects of that weren't really talked about. One of them being the fact that there was very little support and mentorship for women in dentistry when I was going through this journey, and actually through all the people I'm networked with and the stories that I've had, many women are going through the same thing. And then you suddenly add motherhood into the mix, and you go through this change of identity. You then add business ownership into the mix as well on top of that. You then end up suddenly feeling like you're in this whirlwind of overwhelm and you don't know how to get out of it. And this is such a common story for so many women in dentistry. And if you listen to the stories of young graduates, they talk so much about having anxiety and fear and imposter thoughts. Many of them don't know how to be vulnerable and be able to voice some of the things that they're going through. Dentistry is a very stressful profession. In my journey, this was something that went unrecognized. This was something that I didn't notice, and I suffered with a lot of chronic stress and overwhelm that led to 7 years and almost 10 years of infertility. And so I went through 7 years of IVF treatment. And this is another topic that a lot of women don't talk about, is the infertility issues that are happening in our profession, because it's almost like the biology and the career crash. And so that's another reason why I set up Flourish as a female. I wanted it to be an open and a safe space for women in dentistry to learn about self-leadership, to learn how they can regulate their emotions, to learn how they can, manage their time, how they can set boundaries, how they can actually have ambitions and have goals and succeed and grow at the same time, and also build their income as and I don't think there's anything wrong with that, and build their income at the same time. So much. I absolutely love attending the Dentistry show. I have done since I was a student, and one of the things I love is being able to network with people I already know in the industry but I don't see often. I love meeting new people and being inspired. I always come away learning something new and coming away with new ideas as well, and feeling motivated. I come away with a new energy.